Okay, hello, and welcome to Mazars Healthcare Digest, episode 7, covering HCC Coding Recapture. My name is Amanda McBride, and I'm a senior consultant with Mazars in the Healthcare Consulting Group. And today we will also be speaking with Valerie Ostrander, who is a manager in the Healthcare Consulting Group. Today we will be going over what HCC coding is, a little bit about how HCC coding works, HCC Coding Recapture, and then lastly, solving the problem of flow HCC Recapture. So HCC coding is not a new concept and was first implemented back in 2004 by CMS, also known as the Centers for Medicare and Medicaid Services, as part of their risk adjustment model. And this model is used to identify individuals with serious acute or chronic condition, which allows Medicare to track and project the expected risk and future annual costs of care. So first, what is HCC coding and what does it stand for? HCC stands for Hierarchical Condition Category Coding and has become a more popular topic of conversation as more and more organizations are shifting towards those value-based care. And this makes sense because if organizations don't have solid knowledge of HCC coding and how it works, they're risking lower reimbursement rates and potentially not being paid at all. How exactly does HCC coding work and how is it calculated? HCCs are used to calculate the payments for organizations. The clinicians add these HCC codes to the patient's medical records along with any additional documentation that would normally be required by CMS. These different HCC codes represent chronic health conditions as well as some severe acute conditions. As of 2020, there are 86 HCC codes that have been placed in 19 different categories, and these 86 codes are comprised of 9,700 ICD codes, which each represent a singular medical condition. There are also RAF scores or risk adjustment factors that also play a role in HCC coding. A RAF score is a measure of the estimated cost of an individual's care based on their disease burden and demographic information. This RAF score is then used to calculate the payments for healthcare organizations. Each HCC is assigned a relative factor and then is averaged with any other HCC code factors in a demographic score. Then this final score is multiplied by a predetermined dollar amount to set the per member per month, also known as the PMPM, capitated reimbursement for the next period of coverage. So HCC Coding Recapture. Effective HCC Recapture is a reconfirmation process somewhere between a census and an audit. It establishes that patients are still covered and their conditions are still managed year over year. What it doesn't do is account for any new conditions. So this is referring to updating a patient's HCC codes during the current calendar year based on the knowledge of what was captured or submitted to a payer in the previous year. Recapturing of correct HCC codes can lead to a more accurate and appropriate HCC codes, higher risk adjustment factors or those RAF scores, and ultimately higher reimbursement rates. You would think that since a patient's HCC codes are ultimately driven off the underlying clinical documentation, it would seem obvious that providers would update the clinical notes and recapture any relevant HCC codes when the patient returns for a visit the following year. However, data supports that this is not occurring, and on average, physicians are only recapturing about 40% of HCC codes that were captured the previous year.
Thanks, Mandy. That's interesting that only 40% is captured from the previous year. And although I agree that physicians, contribute to play the critical role in the HCC process, right, through their documentation, the complexity of the coding assignment shouldn't really be left on their shoulders alone, right? We need to have our coders looking at these, our data analytics people looking at these and really kind of pulling any of the information from these patients when identifying any chronic conditions within these patient medical records to ensure that these are being pulled forward for the current year. So with the workflow, right, with how this is currently being done in majority of facilities, unfortunately, HCC Recapture is done after a claim has already been submitted. Not the most ideal time to do that, because what you're doing is you're kind of going back and correcting the claim and then having to resubmit the claim to obtain additional reimbursement for services that are being billed based on clinical documentation that probably should have been established and coded at the time of billing. So when you're looking as a coder, when you're looking and trying to do this risk adjustment coding and looking at HCCs, it does require some specialized education to do this, right? Because you're really looking in and really kind of driving down into all those codes that Mandy had, referenced earlier. So what a coder has to do is take all of that documentation, look at previous medical history of the patient, and try to pull all of these together. Because if a patient has a chronic condition, they're probably still going to have that chronic condition the following year. And as Mandy had said earlier, it's not taking into consideration any new codes or any new conditions that come up. So patient may have, COPD the previous year. Well, now maybe this year they acquired diabetes. So now there's another chronic condition that they need to add to both of those HCC coding. If you really think about it, right, patients with higher HCCs, right, will require more intensive medical treatment. Right, so they're going to require more medical management. They may be on more medications. They may be coming into the office more often. What HCC does is it groups these patients into different categories, like Mandy said, based on their demographics, right? So, how old are they? Where do they live? Are there any, what new buzzword is social determinants of health? Are there other things out there in the environment that are affecting their health? And any specific ICD-10 codes, right? And those diagnosis codes. And that correlates to payment, right? So it was expected that the more HCC, the higher the risk, the more treatments that they need, then the higher the payment would be for patients with those higher HCCs. So if you're thinking about it, as you're going through and you're trying to figure out a whole, what's the best way to go about recapturing HCCs, right? What would be a best practice? What you want to do is really get a interdisciplinary work group together. So that would be, coders and your clinicians and your physicians and your data analytics people, right? Get them all together and look at that historical data and identify these patients that have these chronic illnesses, right? So any that are coming into your outpatient clinics or, coming in through the ED or, inpatient stays, wherever the data is coming in. And see who has not been seen in the past calendar year. So if you know that these patients will be coming in, but they haven't come in a year, you want to prioritize those patients. See if we can get them in, earlier in the calendar year so we can kind of track them a little bit better. Then, this work group really should meet at a minimum on a quarterly basis, right? So this would interact with your physician groups, your medical groups, your residents, if you have residents within the inpatient facility, to kind of track the performance and then find any additional opportunities. What else is out there? Are there new things that are coming up that may be affecting what we're doing as a process, right? So really looking at that and having those conversations on a quarterly basis. Then of course, best practice would be, once we find all this information, is to build the appropriate coding within the daily encounter capture workflow, right? So within the EMR, by having an accurate problem list that the physicians can pull from. Okay, that's going to require going in there and doing some cleanup and removing any duplicative or inaccurate diagnosis codes that are in there. And that way you'll start to capture the correct codes for these patients. So as and it would come up and be refreshed for that particular patient and show HCCs from the previous year into this current year and be able to capture all of them all at once. That makes the whole, recapture and looking through and doing the reviews for the coders a lot quicker and a lot less that they're having to go back and have to hunt and peck for. So here's a little bit more information on Mandy and I, just kind of give you a little bit of background on both of us. We've been with Mazars. Gosh, I've been here about almost 4 years. Mandy's been here much longer than I have. And we both really, in our group, we do a lot of revenue cycle, right? So that's more front to back, as we would call it. Front end from when the patient comes in the door to back in when the bills get paid or don't get paid, right? And find out why they haven't. So anywhere in from the front to the back, if there's any questions that any of you have regarding this, just reach out to us. Our contact information is on the next slide. This is, of course, some resources if you were looking for it, but our contact information is right here. Feel free to reach out to us at any time. If we may not know the answer, we would definitely be able to find the answers for you. Thank you again for your time and have a great day.